Thank you for joining us for this instructional video. The purpose of this video is to introduce you to our SARS CoV-2 or the novel coronavirus collection and transport kit. We have designed this kit to minimize exposure to the virus and keep you, your staff, our drivers, and our staff as safe as possible. You will receive our kit in one complete package. The kit will contain the Primex requisition form, the collection device, the outer bag, the inner bag, and finally, a fluorescently colored label. Before starting the collection, make sure to wear gloves, and wipe the work area with the appropriate solution. 10% bleach solution can be used for this purpose. Discard the wipe in the appropriate bin. Next, and before collecting the sample from the patient, make sure that you fill out the patient requisition form with the patient information, date of birth, and all the pertinent information on there. And also make sure that you label the collection device with the appropriate name of the patient and date of birth. Place the requisition form in the appropriate area of the outer bag. Also, prepare the outer bag and the inner bag to receive the sample by opening the Ziploc area. Wear a second pair of gloves before proceeding with the collection. You will find a video link detailing the collection steps at our website for your convenience. After the collection, try to handle the collection device and the inner bag as minimally as possible by grabbing only the tops of both the collection device and the inner bag. Place the collection device inside the inner bag and seal the top. After that, remove the outer gloves and place them in the appropriate bin. Wrap the inner bag like so and place the fluorescent label on top of the inner bag to close the top. Place the inner bag inside of the outer bag and seal the top of the outer bag completely. Make sure the surface area is wiped clean after every collection. And the wipes are discarded in an appropriate bin. Thank you for joining us for this instructional video. We hope that this was helpful.